Hey everyone, welcome back. Today we're diving into something I know a lot of you have been asking about, LASIK surgery. We're going to really break it down, what it is, what happens, and what to think about if you're considering it.
It's definitely a hot topic.
Right. So we all know LASIK is supposed to help you ditch the glasses or contacts, but let's get back to basics for just a sec.
Sure.
How would you explain what LASIK actually is?
So at its core, LASIK is a surgical procedure, but it's very precise. Basically, they use a laser to reshape the cornea of your eye.
Okay, the cornea, that's the
Clear front part.
right, the clear front part, and that helps to, what, focus light?
Exactly. It helps focus light onto the retina, which is what allows you to see clearly.
Gotcha. So it's like giving your eye a custom-made lens in a way.
That's a really good way to put it, yeah. And by reshaping the cornea, LASIK can correct a bunch of common vision problems. We're talking nearsightedness.
Farsightedness.
Yep, astigmatism, even presbyopia.
Presbyopia. Wait, remind me what that one is again.
That's the one that comes with age. You know, when you start holding things further away to read them?
Oh, right. Yeah, I'm starting to get that.
Happens to the best of us. But the cool thing is LASIK can actually help with that, too.
Really? I didn't realize they could use LASIK for that.
They can. Instead of just correcting for distance, they can actually tailor it to create what's called monovision.
Monovision sounds kind of sci-fi.
A little bit, right. But basically, one eye is corrected for distance, and the other's adjusted for near vision.
So it's kind of like having built-in bifocals.
Exactly. Takes some getting used to, but a lot of people find it really freeing.
Wow, that's incredible. But I imagine there are some things you have to consider before just jumping into LASIK, right? Like, I'm guessing not everyone is a good candidate.
You're right. There are definitely some requirements. One thing they look at is your contact lens use.
Really? Contact lenses, why does that matter?
Well, contacts, especially the rigid gas-permeable kind, can actually change the shape of your cornea.
Oh, really? I didn't know that.
Yeah, it's temporary, but to get accurate measurements for the laser, they need your cornea to be in its natural state.
Ah, that makes sense. Like trying to tailor a suit over a winter coat, you're not going to get the right fit.
Exactly. And it's not just contacts. Being upfront with your doctor about any medical conditions or medications is crucial.
Yeah, even if it doesn't seem related to your eyes.
Exactly. Could be important for figuring out if LASIK is right for you.
Transparency is key.
Yeah.
Making informed decisions and all that. So, okay, say you've had your consultations, you're cleared for LASIK, the big day arrives. What can you actually expect when you walk into that laser room?
You know, it's actually less intimidating than a lot of people picture.
Really?
Oh, yeah, you're awake the whole time.
Okay.
But you get numbing eye drops so you don't feel anything. And you're lying down in this reclined chair. Actually, it's pretty comfy. And they use like a little device to keep your eyelids open.
See, that part always kind of freaked me out. Even without lasers involved, holding my eye open.
Yeah, I get that. But it's just to prevent blinking during the procedure, which makes sense.
Yeah, definitely don't want to blink at the wrong time. So then what? The lasers just start firing.
Well, not right away. First, they use this incredibly precise laser. It's called a femtosecond laser.
Femtosecond.
Yeah, it creates a super thin flap in the cornea.
Hold on, femtoseconds. Those are like crazy tiny fractions of a second, right?
You got it. Unbelievably short bursts of time. It's all about the precision with this thing.
Wow. Okay, so they make this flap. Why?
It's to get to the underlying cornea, that's the part they reshape. So once the flap is made, they switch to a different laser, the excimer laser.
Two lasers. Okay, so the excimer, that's the one that actually...
Corrects your vision, exactly.
Okay, and how does that work?
It's called photoablative decomposition, basically. It vaporizes these microscopic layers of corneal tissue to shape it.
So almost like sanding down wood to get the right shape.
Exactly. Very controlled removal of tissue. And the best part, the whole thing usually takes less than 30 minutes.
Seriously. That's it.
That's it.
Wow. Well, okay, I guess no matter how fast it is, there's got to be some recovery time, right? It's still surgery. What are you looking at right after?
You will have to wear an eye shield for a few hours afterward. And of course, someone else has to drive you home.
Right, that makes sense. I imagine your vision is a bit thought off right after.
Yeah, it could be a bit blurry. You might be sensitive to light, see halos, maybe some discomfort. But good news is it's usually temporary. Clears up in a few days or weeks.
Okay, good. So no marathon gaming sessions or anything right after then?
Maybe take it easy for a bit. You'll also have a post-op routine, eye drops, meds, that kind of thing. Prevent infection, reduce inflammation.
Makes sense. Speaking of what not to do, we came across some pretty surprising post-LASIK no-nos in our research. Let's dig into those next. All right, so post-LASIK don'ts. What's out there that might surprise people?
Well, for starters, and this one's huge even though it sounds simple, don't rub your eyes.
Oh, come on, seriously, like that's even possible,
I know, right? It's such a reflex, but you gotta resist. Remember that corneal flap?
right?
It needs time to heal, and if you start rubbing your eyes,
Oh, yeah, you can mess it up.
exactly, complications. So, another one, swimming, big no-no.
Really? No swimming at all?
Not for a while. Anything that could irritate your eyes or worse, cause an infection, especially while that flap is healing. Pools, lakes, oceans, all a no-go.
Wow, okay, so even a quick dip is out.
Mm-hmm.
What about showering?
Showering's fine. Just be careful not to get any soap or shampoo in your eyes.
Right, makes sense.
And on that note, hold off on the makeup too.
Makeup. Seriously, how long are we talking?
Depends. Your doctor will give you the specifics, but at least a couple weeks probably. No eye makeup. Again, it's all about those products potentially having bacteria, and you don't want that anywhere near your healing cornea.
Okay, so no rubbing, no swimming, no makeup. Sounds like a good time to embrace that au natural look.
Right. Healing first and foremost. And one more thing along those lines. No contacts for a while either, even if your vision's a bit blurry at first.
Really, but I thought the whole point of LASIK was to ditch the contacts.
It is long term, but your cornea needs to settle into its new shape first. Your doctor will let you know when you're good to go.
Makes sense, makes sense.
Yeah.
So when can you get back to normal life after LASIK? Work, gym, all that good stuff.
Most people can go back to work, everyday stuff within a day or two.
Really? That's quick.
Yeah. But more intense things like the gym or definitely contact sports, gotta hold off on those for a few weeks at least. And even when you're back in the swing of things, protecting your eyes is key. Sunglasses aren't just for fashion anymore. Gotta shield those eyes from UV rays.
It's all about following doctor's orders and listening to your body, it sounds like.
100%. LASIK can be amazing, life-changing, but like any medical procedure, there's recovery, there's aftercare, you gotta be diligent about it.
Well, we covered a ton of ground today. Everything from the science behind LASIK to all those post-op no-nos. Some of them were definitely news to me. It's been fascinating to take this deep dive, really understand what clearer vision is all about.
It really has. And honestly, it highlights how important it is to be informed, talk to your doctor, ask all the questions you have.
Absolutely. It's your vision, your health. Got to be proactive. And that, everyone, wraps up our deep dive into LASIK surgery. Hope you enjoyed exploring the world of clear vision with us. Until next time, stay curious.